Hi, everybody. I am Monica Molenaar. I'm one of the co-founders of Alloy Women's Health. We are a dedicated telehealth site for women who are in menopause or perimenopause, where you can access information, expertise with really menopause literate focused doctors, and the solutions that we offer, prescription solutions mainly, which are menopausal hormone treatment, birth control, a whole wide variety of things that are applicable in menopause for women who are experiencing symptoms or want to prevent worse outcomes later on. So that's Alloy. And we are very super excited to be hosting another conversation with one of our favorite doctors in the Menoverse, Dr. Kelly Casperson, board certified urologist in Washington State and host of one of the most amazing and viral podcasts with over 1 million downloads. You're probably almost 2 million at this point, called You Are Not Broken. And also Dr. Casperson just released a TED Talk that went viral about all of the fact that adults need sex ed. So that's sort of what started this conversation. We have become good friends through this work, and really enjoyed having these types of conversations and giving women more information and power to make choices for themselves. So thank you so much for joining us, Kelly. I'm just going to call you Kelly because it's easier.
Call me Kelly.
And that's what we call each other. So if you could just give your own little bio, I think that would be helpful. You are a urologist, and I think your experience as a urologist is one of the things that makes your perspective so unique. So if you could give everybody a little sense of what you do in your day job when you're not podcasting and storming the world with your TED Talks.
Yeah. Well, thanks so much for having me again. I love chatting with you. This is hopefully the second of many, because now, I'm like, and then we need to talk about this. We need to talk about this. So I love talking. I was a urologist. I am a urologist. I was kind of deciding between like emergency medicine, OB-GYN, and urology in med school, right? And like urology was the best. They were the funniest people. Like you could change people like that. Like your kidney stone's gone, your bladder cancer is gone. Now you can pee. I love the like short-term validation that because I showed up at work, your life is better. And mostly we just take care of penises and like give them Viagra. And we always thought everybody else was, I don't know if we even thought about who was taking care of the person that they were wanting to sleep with. It was kind of an afterthought, right? And fast forward 7 years into private practice, I had a patient who was crying in my office because of her sexual health concerns, and I didn't know how to help her. And so I just deep dove into the literature, read all the books, went to the conferences, started realizing gynecology doesn't get taught this either. They're busy. They're taking care of birth control, abnormal bleeding, pregnancies, hysterectomies. They're busy too. And a voice in my head was like, you need to start talking. And that was the birth of the podcast about 3.5 years ago. And so since then, there's been a book and there's been a TED Talk basically trying to, reach all the people, because this is a huge, huge, huge problem. We're so underserved. The physicians didn't get education, both in sex ed and in hormones, right? So I really got into hormone advocacy because of sex, because the big myth is like, well, there's not going to be any more sex after menopause. And I'm like, what's the research say? What's the literature say? And although we need more research and literature on this, overwhelmingly, your sex life does not have to go down the toilet. And it's a myth that it does. There are actually people having the best sex of their lives well past menopause, even with erectile dysfunction, all the things. But it's still such a shame and such a stigma that we need to talk about it more, because so many people feel broken and alone and they don't know what to do.
Yeah. Well, and thank you for that. And in thinking about sort of setting up this conversation, I was really sort of thinking about like, what is the best sex ed that you never had? And what are we trying to do here? So I think, first of all, reassure women that if you're not having the best, most mind-blowing sex of your entire life right now in your midlife, you're probably not alone, but there are things to do about it, right? So we're going to learn some tools and some things that we can actually do to improve our sex life, offer potentially some new ways to think about what actually is a good sex life. Like, I think that's one of the things that none of us really knows. We have this idea of what it should be. And I know you talk a lot about stop shoulding all over your life and yourself, but it's a really important concept. Like there is not necessarily a should, but there are different things that people can explore, that we can normalize and, give women and men, couples, whatever, whoever is engaging in sex, sort of more tools and a sort of broader playing field. And then, obviously I'd love to talk about some of what those specific tools are.
Totally. I mean, just for this to start people off, like think about the sex ed that you got or didn't get, right? And usually pregnancy and disease prevention plan, fear-based,
yeah,
right? Lots of people got abstinence training only, lots of shame in that. And then you're like set into the, free adult world, free range without any knowledge. So where do we go then? We go to Hollywood. We might go to porn. We might go to erotica books, right? Where you really get this curated, performed presentation of what like a, idealized, air quotes, sex is, which again is not real life with real humans in long-term relationships, with health issues, with kids at home who are exhausted. Like none of that is modeled for us of like how to keep sexuality in a normal person's life, because everything we're watching is fake.
Good point. I saw want to take a step back. We will, the Q&A is open for questions, so we will leave some time at the end for questions. I just checked and it looks like the volume is low. I don't know if hopefully people are able to hear, but just making sure. If anyone else is having a hard time with volume, please let us know and put that in the Q&A. So back to you being a urologist, I think one of the things that's most interesting is the fact that you treat men, and you talk about this a lot, sort of the different ways that men in midlife, or men from midlife on, or men all the time, are treated differently from women, but specifically related to menopause and sort of when women actually have the guts to even advocate for themselves in a doctor's office about sexual health. What do you see there in your own practice, and how has that sort of informed your feelings about teaching women about sex now, and sort of also offering different solutions for women?
Yeah, I mean, it's a great point of I see how we treat men, and men come in and they're like, my penis doesn't work as well and I'm kind of tired. And we're like, here's some testosterone, here's some Viagra. It's not, we're not questioning the validity of their human experience like we do so much with women. Women are like, yeah, but is it that bad? I see that all the time. Like, is it that bad? And then it kind of puts it back on the woman to like justify if it's bad enough. And I always say, like, dude, she got parking, she got childcare, she took time off of work to go to the doctor. It's bad. Like, why are we questioning that? And we never ask a guy, like, is your soft penis like bad enough? Like, we just offer solutions for it. We don't question the validity of their experience. And I think that's one of the glaring things. I think the other thing we do is like, there's side effects to all medications. That's just a known fact, right? There's side effects to Viagra, there's side effects to testosterone. But when we present these options to men, we're not like, but there's side effects, so I don't know if you should do it. Like, we don't lead with the side effects. Whereas in women, and again, I'm stereotyping, but like with women, we tend to lead with the side effects of like, yeah, but these things have side effects. Are you sure you want to do it? And it's almost this like,
No, sorry, keep going.
Okay. It's almost like we do this, we want to be protective. We don't want to hurt anybody. I get it, but we treat the genders very differently with that.
Yeah, and we also are constantly speaking to women in terms of can and can't. You can take this, you are a candidate, you are not a candidate, I can't take this, as opposed to the benefits and the risks discussion. Yep. What are the trade-offs? What are the things that you're feeling in your own life? How do you personally want to move forward in your life with agency and mojo, which I know you just did a podcast on mojo, which was super interesting also, just to think about, this is a great time of life. You now have the opportunity to sort of take stock of all the experience that you've had thus far, the networks and people that you've met, and sort of things that you've done up until this point, and what I've tried to be sort of conscious about is really taking stock of all of that and being deliberate about how I want to move forward. And I think that, that's kind of where sex comes in also, and why sexual health, it's been really interesting over the last few years since we started Alloy, and really sort of delve deep into this subject with the public to see how much pickup it's gotten in the last, really in particular, I think the last 2 years, and how many more women are talking about it. In particular, I think, now that Gen X is really, we're here, and we're smart and we're savvy, but we're not old, and we don't see ourselves as old. And we, I think we all grew up with sort of complicated relationships with sex that we're trying to kind of relearn and retrain what we know, and how to show up for ourselves, and really, embody this idea that we can take care of ourselves first, or at least in the mix.
Yeah,
And not,
I love it. I think the other big gender stereotype for, let's just keep on the sex topic of, like, a man comes in with erectile dysfunction and low testosterone, right? And we're not like, well, it's natural. It's how it is. You should be natural. Don't you want to be natural? Your friends are being natural. We like natural shame all the women, right? Like, oh, I'm 52 and it's menopause. That's natural. And it's like, we don't say that to men. And I love holding up. I think just the gender discrepancy is so wonderful to mirror to look at, right? Of, we're not like, erectile dysfunction is natural, and so is declining testosterone on the order of 2% a year, right? But we treat them because it's a quality of life issue and we can make their life better.
Right.
And until we treat everybody the same, there's a huge gender bias in how we think about who should be natural and who doesn't need to be natural, whatever the heck natural means.
Well, and also, by the way, I mean, if you don't treat the symptoms as you get older, or you don't treat your skin the way that it should be treated, your vaginal skin, then sex isn't going to be pleasant. And, maybe it's good for one party if it's as you always say, penis and vagina sex, but if it's not, then, there are other things to do. And obviously we should be treating women as well. So back to sex, or continuing with sex and your TED Talk, which was tremendous, and really became a viral hit almost overnight, I think. One of the most interesting things that I think you talked about is this concept of biopsychosocial, and that having a good sex life, or the thing that we really need to understand about sex, and this is sort of the crux of the sex ed, is that it's not one thing, and it's so many things wrapped up together, and there are many organs, not just your pelvic organs, that are involved in having good sex, or
yeah, totally.
having a satisfying sex life. So can you talk a little bit more about that concept for those people who don't watch the
So
TED Talk?
biopsychosocial is, it came from the psychiatrists, or, the mental health people, of like, because the other things are biopsychosocial too, right? Basically what it means is, like, our bodies exist in a world that has a culture where we interact with other humans. So bio is biologic. That's our hormones, how our body is built, what's happening, the diseases we might have, the health concerns. That's bio, but it doesn't exist in the vacuum. It exists in a culture where women are conditioned with sex differently than the men, right? Or in a culture that wants to protect or kind of corral women's sexuality. So that's the culture we exist in. And then social, or biopsychosocial. So psycho is your brain. So what you think about sex, what you think about your body image, how your relationship is with somebody else, which is huge. I mean, just a classic one is, like, if you mother your partner, your sexual partner, you might have less libido towards that partner, because when we mother things, we don't want to have sex with the things we mother. And I see so many, especially heterosexual relationships, where the woman has taken on a mothering role, and then she's like, I don't have any libido. And it's like, yeah, you're mothering your sexual partner, right? And just paying attention to, like, oh, that's interesting, right? Because there's tons of studies on all of this, but we don't have that data. And that's really where my podcast came from. Is like, I want women to have all the tools so that they can go in and self-advocate, so they can go in and share this information. Because this isn't stuff that you're getting on Hollywood and, whatever, all the television stuff of like, and I hated the word biopsychosocial. I hated it. Like, I'm a surgeon. I went in kicking and screaming. I wanted this to be easy. I wanted it just to be like tactical and figure it out. And as I was writing the TED Talk, which was really geared towards women in the beginning, I wanted to do like the myths of women's sexuality. I was like, yeah, but erectile dysfunction is the big elephant in the room on this. And I need to engage everybody because a lot of them want to sleep with the women, right? So they need to be engaged. And the more I kind of made it to include everybody, the more I'm like, darn it, biopsychosocial is what people need to know. So I feel like I'm like, I went into that word kicking and screaming too, but you break it down into like the 3 different components. It's a really nice way to learn sex ed.
Yeah. No, and it's so true also. If you really think about, if I think about my own experience and, both growing up and sort of my younger self and my current 49-year-old self, it's different. And you live through so many different lives also within those years. And if you're in a long-term relationship like I am, I've been with the same person for 26 years. You go through different stages, phases, and obviously, he's made me swear I wouldn't talk about him today, so I won't. But
But I think that's really important to talk about because people like, so there's this thing called the limerence phase. And what the limerence phase of a relationship is that enamored, your brain's basically on cocaine, right? Like, it's just a dopamine high. This person can do no wrong. They are sexy AF. You want to be with them all the time. Like, it is your brain on basically drugged, bonding you and connecting you with this new sexual partner. That fades. And that fades in the research by about 12 months, 12 to 18 months. And so people like, they're really like, I fell out of love. And it's like, did you fall out of love or did you fall out of the limerence phase, which is totally normal to be like, I understand this person. I know their quirks. I know what their triggers are. Like, it is a different relationship the longer you're in a relationship. And that doesn't mean that you have to stop being sexual. It means sex is going to be a different thing because it's not novel unless you make it novel now, right? So it's really understanding how the brain works to be, we all think we're these unique individuals of it's like, it's neuroscience, sorry. Like, but it's so validating for people to be like, oh, there's a reason that I just don't like instantaneously want to have sex all the time. It's like, yeah, it could be that it's not rewarding for you. That's their dopamine system, right? It could be your hormones are changing. It could be that it's the same thing every day and you're sick of macaroni and cheese for lunch. So it could be like so many different things, but the more we learn about it and the more we learn about ourselves, the more tactical we can be when we're like, I want to figure out how to make sexuality a part of my life, but it's not going to come spontaneously unless I get in and out of relationships about every year.
Yeah. I mean, that sounds a little tiring. Could
It
be
sounds
fun.
exhausting. It also sounds very expensive.
Yeah, that's true. But actually, one of the things that I love the most about what you say is try to create sexual sort of an environment for yourself or sexual situations that you want to repeat. So make sex worth having. That's one thing I love that you or do have sex that's worth having, and then you'll want to have more. But also, I love the fact that when you talk about like, it's like going to the gym or and we've been conditioned to think that everything needs to be just spontaneous, to be romantic and to be exciting but actually it's something that you need to practice and you need to invest in and you need to commit to. And, I think, so
Yeah.
is that correct?
I mean, it's like, if you want it as a priority in your life, you need to prioritize it. You're not going to accidentally have this amazing sex life outside of the limerence phase when your brain is like so full of dopamine, you can't even you don't even want to go to work. Right. So that comes and goes. But yeah, it's this myth of like a long-term sexual relationship is natural. It's that damn natural thing again of like, not for a lot of people. A lot of people are like, I need to prioritize this. I need to set aside time for it. I need to make sure my pleasure is as important as my partner's pleasure. Otherwise, I'm not going to want to show up to the party. And really, the part about it being novel can take part in the bedroom, right? If you're like, I want to do it a little bit differently today, or let's use this pillow today, or let's do this toy today, as much as you want, but really novel with your partner outside of sexuality is very good for attraction. So like
Huh.
seeing your partner do something they're very good at is very attractive to a lot of people. Going dancing, going to, you know, a park or an amusement park, laughing, humor, right? It's like putting yourself in, because so many people with their partners are like, and then we go to work and then we take care of the kids and then we clean the house. Dun, 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 dun. And it's a very repetitive pattern. And you want to kind of bring in that novelty, everyone as you can, right? But it's actually quite good for attraction to partners.
I love that. Just coming up with, I mean, I guess that's sort of where date night also started, but that concept. But yeah, just doing fun things together, creating good memories. I was watching some Instagram post today about where it was actually interesting, and I won't digress too long, but it was a man, you know, sort of setting up, he was playing both parts, but setting up the like the husband who comes home after having dropped the kids and is like, hey honey, I'm ready to go, and she's, you know, reading this book about emotional intelligence, like, hey, how about validating my experience, how about, you know, doing things together outside of when you want to have sex. That's actually something that's going to make me feel more attractive if it's not just like, okay, I'm free for 15 minutes, let's do it, you know.
Yeah. Totally.
So
I love that guy. And that guy like needs to be on my podcast. He is so good on Instagram. I love watching his content.
he is great. I wish we'll figure out who he is. I can't remember his name and put it in our
The
notes.
point of that that I want to bring back to people here is if you don't have spontaneous desire for sex, but your partner does, nobody's wrong. Nobody's bad. Nobody needs to change. It's just two different people having different sexual styles. And that could be for many, many different reasons, right? But I think so many people, especially women, feel pressure to like match their partner's libido or be ready when they are, always be ready to respond. And that's not how we work. And it also is kind of drains one's libido. If you're like, I always need to be receptive when another person wants me to be, that's actually not very sexy, right? For a lot of people. And that's why I love adult sex ed, is like, because we give you the information, you can step back and think about that and be like, oh, okay, how do I like to be propositioned for sex? Do I prefer it to be on a schedule? So I know that it's not going to just happen here and it's going to happen here. So we can kind of cuddle and hold hands, but no, it's not going to lead to something. And I can be all in on that. So many people are like, I don't want to cuddle. I don't want to go to bed at the same time because I'm afraid it's going to lead to sex. And so we get into this like avoidance pattern. So I'm throwing a lot of information at people, but just to start stepping back and being like, how is it working in my life? How is that working for me and my desire? How would I want that to be different? And then you get to work on communication.
Which is always the hard part for a
So
lot of
hard. I
people.
mean, it's so easy for me because like, look what I do for a living. But
Yeah.
like, I tell you this, it gets easier. It gets easier. It gets easier. It gets easier because now you're on your 9th conversation about sex, not your first one. And it gets easier and easier and easier. And my tip for communication is always lead with positive, have it be about we, us, the relationship. And then walking is a great time to talk about sex because you're not like actually looking at each other, and movement's very safe for humans. And then revisit it. Like you're not one and done. And if you can talk about what's good in the good times, it sets you up for being like, okay, right now, no, because I've got a 6-week-old at home. Or right now, no, because I've got a lot of work deadlines. Right. So like talk about it when it's good, because inevitably there will be road bumps. And if you've never talked about it and now there's a big problem and you haven't had sex in 9 months, it's a much bigger deal.
Yeah. It's funny about the positive feedback. I feel like just generally in life, I like to be generous with positive feedback, because then when you have some less positive feedback, it's received better.
Totally.
You know?
Somebody taught me about the poop sandwich. Have you heard the poop sandwich? The poop sandwich is you put the negative feedback in the middle of two good things. You put the poop in the middle of the sandwich.
Yeah.
It's very
And so
easy for me to remember.
do you have any tips on for all the psychos out here like me who get wrapped up in my head? Do you have any tips for quieting the psycho part?
Yeah. So let me just clarify. Like my brain's always on. I'm always kind of planning. Like I'm always thinking about the next thing, not being in the present moment. That kind of, yeah.
Yeah,
It's
not being able to quiet your mind and sort of be,
very
Okay.
common. super common, especially in female brains. Our brains are very well connected, and they're always kind of checking things. Mindful meditation, really being able to see the thought and not latching onto it and just letting it go, is super, super easier said than done. But it's amazing how little practice you need to get really good at it. Because like, you'll be in the middle of intimacy time, some zip will come into your brain about what do you have to do tomorrow. You can be like, there's that thought, I'm going to let it go. This is telling me I need to get back into my pelvis. I'm going to change my angle. I'm going to add the vibrator. I'm going to reconnect with my partner, instead of like, well, shit, I was thinking about the fireplace repairman again needing to come, and now I'm out of sex. Like, no, you don't have to latch onto the thought. You can see it, you can let it go, and you can use it as a tool to be like, I'm not in the present moment. I am not in my pelvis. Let's get back down there.
That is a really great idea.
I am loving the Waking Up app, Sam Harris's Waking Up app, 10-minute meditations a day. There's a free version, there's a paid version. It's amazing.
Yeah, you told me about that. I'm a sort of a sucker for the Aura app. So I use it when I go to sleep.
There's a Headspace app, but
a lot.
It works for sex, and it also works for all the other areas of your life too. So it's awesome.
Yeah. The funny thing is that I always listen to the exact same, I have one thing that now I'm sort of superstitious also. Like if I don't listen to this one thing, I'm not going to fall asleep. So
that's so different than me.
Whatever,
I need something new every time.
Yeah. To have one, one option basically.
Yeah.
All right.
That was a good question. I think a lot of people struggle with that. And then they're like, there's a thought, damn it, sex is over. Like, no, that's one option.
All right. Now I want to move to the bio part, because this is one of my favorite topics, the clitoris.
I love bio.
I mean, you actually said in one, and maybe it was in your TED Talk, that the clitoris is the only organ in any human body that is solely there for pleasure. And almost nobody knows about it, or we discount it, or we're not allowed to even say the word. So let's talk about it.
Isn't that crazy? And just for the people in the back, what about the penis? The penis has to get urine out. The penis has to get sperm through it. So the penis actually has 3 jobs.
Clitoris has nothing.
You're welcome. Else. The clitoris is the only organ in the body that's solely designed for pleasure. And 50% of us walk around with it 24/7. And
don't know anything about it, really.
No, a lot of people don't even know how to use it because of the psychosocial part, right? And that's why it's so important, especially when we talk about bio, to not overly simplify life and be like, it's just your hormones. It's just the erection dysfunction. Like, no, our human bodies exist in a world, right? Which is why I now like the term biopsychosocial, because it really describes it. But I think a lot of clitoris owners don't know how to use their clitoris. And this hurts us, because if we don't know how to use our clitoris, the people who don't have a clitoris definitely don't know. But we give away all of our power to those people, right? We're like, they don't give me an orgasm. They don't know what they're doing. It's like, they don't even have one to practice on. Like, you've got to give them feedback. And in order for you to give the best feedback you can give, you should have an operating system manual. Like, take it out for a test drive every once in a while.
So masturbate, basically.
Masturbate. But it's like, what do you like? Do you need it a little more firm? Is the glands too sensitive? Do you like more external vulvar vibration? What type of lube feels best for you? Do you like it not when you're cold? Like, do you like it with something in the vagina? Like, now I feel like Dr. Seuss. Do you create eggs and ham?
No, but it's interesting. I mean, I think, back to sort of the stereotypes that so many of us grew up with, you certainly weren't allowed to want or like sex publicly, because then you would be labeled a slut. And if you didn't have it, then you were cold or a virgin or whatever, not sexy.
Yep.
And you certainly couldn't go public with it. But then if you were in private, you were supposed to be pretty sexy, but not too sexy, because then you might be kind of, skanky or whatever. There were like so many buckets to kind of or a whole maze. I don't even know how to describe it, but just like so many things, so many rules that you had to internalize and figure out how to
Yeah, I mean, that's what I love so much about adult sex ed, is because I'm like, adults are smart, we're savvy, give us some things to think about. And I think so many people don't even know the culture influence that they have, right? They just think it's like natural for them to have shame about their body. It's like, no, no, no,
Yeah,
you were told that, which gives you all the more power to be like, I'm not going to live like that anymore.
yeah,
Right. And
exactly.
it's truly liberating and sets people free of like, oh, I didn't even put those thoughts in my head. Now I'm really going to discard them.
Yeah. But that's one of the things I think has been so exciting about starting Alloy, and being able to actually offer not only really the access, both the expertise and also the products. And, one of the things that I actually really didn't know until starting Alloy was how important vaginal estrogen is to maintaining, both just the sort of skin health in not only your vagina, but your bladder. And also how important that is for continued sexual health. And then all of the other tools to enhance sexual, arousal, feeling, libido, etc. So at Allo, we do offer, and our doctors prescribe, vaginal estrogen. There are, and you can say this better than I can, but there are pretty much zero contraindications for anybody to use vaginal estrogen. It is super safe, over the counter in so many countries, and really has been poorly offered to American women. But also there are other prescription products that can be helpful. One, topical sildenafil, which is generic Viagra that has been available for men for 25 years in a way less safe form, as in taken orally. And what we've discovered is that actually, as we know, the clitoris and the penis are the same organ. And so if you use Viagra topically, it's a great tool for women, just as something else to enhance your pleasure, enhance your libido. Like, why wouldn't you use it? And so, I think it's super important that women know what the options are and the tools that they can use that we're giving to men. So, and all the medications have, up until this point, pretty much, that we take, have been tested on men, including medications for women. So why now can't we use the things that have been safely used by men for 25 years?
Yep. I love it. And I think just normalizing conversations like this, to be like, my job is to give everybody the education. Like, I'm not going to tell you what you need to do, but I need to tell you that there's stuff available, because all of this suffering, frankly, I'm sick of it. Like, I'm so sick of it. I'm 52 and now I have UTIs, overactive bladder, sex hurts, and I don't have desire anymore. What could it be? Right? And it just tells me like our menopause education in this country and in this world is so bad. People are like mystified when menopause happens. I just saw this thing on the internet, and they went around like asking women, like, do you know what perimenopause is? And like all the women are like, no, no, no. And I'm like, this is like things that happen. Our vaginas, our vulvas, our clitorises, our bladders are all affected by low hormones. And we can give them local hormones. Certainly we can use lube as like the bare minimum of what we should be doing for sex.
And which lube?
And
Silicone-based lube, water-based lube? What's the right kind
I
of
like
lube?
I like oil based, and I like silicone based, because I want something long lasting. I don't like the tacky feel, and I don't like cold. But not always in that order. But so for me, water-based doesn't make sense for me. If you're going to use condoms and need to use condoms, water-based is your best, is your safest. So water-based, if you're going to do that. People will be like, no silicone with silicone toys.
Yeah.
I am a badass who breaks rules. I use silicone with silicone toys because screw it. Life's too short to have two different types of lube, depending
What does
upon
it
what
even
toy you're
do?
going to use.
What does it do to the silicone?
Over time, it will degrade this. So like dissolves like. So
Yeah.
over time, it can degrade it. But my friend who actually owns a sex shop stuck silicone toys in silicone lube like for 2 days straight just to see, and they were fine. So like over time, yes. So, but that's why people say that, like, don't use silicone with silicone toys. But I'm like,
Also more of this can't.
right.
Don't do
Like
this, don't do that.
you're not going to set off
Try
a
it.
World
Yeah.
War III by using silicone lube with silicone toys. Like, go for it. Natural lube suggestions. Coconut oil is great. I'm just answering a question about lube in the Q&A. Coconut oil is great. That's oil. That's an oil-based lube. Silicone is natural. It's a freaking element, right? But you know, like, I'm the first one to pick on whatever natural means. Silicone's on the periodic table. How much more natural can you get?
I don't think I realized that, actually. I don't have my periodic table memorized.
Right now, I'm going to Google what element silicone is.
And what about vibrators? Like, there are different types of vibrators, or there are specific ones that you like. How do they work? What messages are they sending to the brain? Are these suction ones? Are they different? Is it a better experience? Just try it, see what you like.
I think it's a try it and see what you like. If you have the great fortune of a well-curated sex shop in your town, like, go in and talk to these people. They're very knowledgeable, and they will not sell you something that's like a master's degree if you need to, like, just learn how to walk sort of thing, right? Because there's stuff where you might be too much for you. And I think that way with the clitoral suction devices, or the air pulse devices, right? Of like, that might be advanced for somebody who's like doesn't really know where their clitoris is. And now you're like, put this directly on the glands for the most intense pelvic anything you've ever felt in your life. It might be a little much.
Yeah. I mean, I will say that somebody once sent one to me. I have a friend who works at a company that makes those vibrators. And my recommendation is try it out on your own first, because it's kind of intense. And it's like, intense. you don't know, it's a very private and individual experience, was what I found. So it's not really group play.
I think the other thing I'm seeing more of is external vulvar vibrators now. They're more palm shaped, or oval shaped. There's some that have holes in the middle of them, so you can still penetrate through them, but really focusing on vulvar blood flow, vulvar vibration, is very cool to see, because for a long time, I think what was available for people was just something to put in the vagina, really replicating penis and vagina sex. And the data more and more is like external vulvar you got to warm it up. You know, you've got to have massage. You need to have vibrators. You have to really let the pelvis get blood flow, dilate. There's erectile tissue there. All pelvises have erectile tissue. And if we just start sex by putting something in the vagina, a lot of the time it's like a cold start, right?
Well, that actually is why the sildenafil is so great, because what it does, and at Alloy we call it amazing cream. So if you're looking for it, it's amazing, and it is amazing. It's a really nice tool, but what it does is it draws blood flow to the area, the same way that Viagra, the brand name of sildenafil, will draw blood flow to the penis and make it erect, right? Yep. As I understand it. So the penis and the clitoris, same organ, just different size, and therefore there's no, obviously, have slight differences in practice. So you only need a small amount topically, to sort of bring that blood flow and enhance arousal, but also enhance sensation. A lot of women feel numb, especially when their vaginal skin and clitoris isn't properly estrogenated. So it is important, as we've learned, to make sure that and this is why vaginal estrogen is such a great product and so important, that these other tools will not really work and help as well if you have dry, thin skin down there, if you have painful, tearing or itching, like then a sildenafil may actually make you more sensitive. So you need to make sure that your vagina is properly estrogenated.
Yeah, those are all really good tips. I think another thing that the sildenafil, the sildenafil cream, the warming creams, oil, stuff like that, is it really gives a little sensation down there and really helps, like, focus on the pelvis. Like, there's something going, let's focus down there on the pelvis, and really kind of dropping us back into our body, getting us out of that brain that is in a whole bunch of different places. They've actually studied orgasm in MRIs. Like, they put people in MRIs and make them have orgasms and take pictures of their brain. And orgasms only happen when you're in your body in the present moment. Like, you cannot be thinking about the past or planning the future. The orgasm doesn't work. You literally, in having an orgasm, we shut down our frontal lobe, which is our thinking, planning, organization
Wow.
center. I know, it's cool, right?
Yeah, that's
So
really cool.
it really is like a present moment sexual experience. And if you find yourself in the future or in the past, that's not where orgasms live. And I do think like that arousal cream, the warming cream, it's just another thing that you're like, oh, let's pay attention down there right now. I think it's just another little micro focuser.
Yeah. Although I do, having used it, and having being in menopause and sort of going, I mean, all of this really is like sort of me solving all the problems that I need to solve for myself, and realize that also everybody, if I solve it for myself, then I can give everybody else the secrets. But I think that it actually increases sensation. And for a lot of women, as we age, the sensation just gets less. And so if you can enhance it a little bit, it's makes for a better experience that you want to repeat.
Yeah. And I think that again is why the power of the vibrator too, is because sometimes you do need a little more friction. You do need a little more stimulation in order to have an orgasm as we age, especially we do not have a lot of data on women and high blood pressure, diabetes, insulin resistance, all of these things that we know cause erectile dysfunction. Well, we have a penis too. It's called a clitoris, right? Same matchup. So it's like, as our body might have these health challenges, our body parts do change. We have tons of data on males and penises and erectile dysfunction. We do not have the equal and opposite clitoris dysfunction studies, but one can extrapolate, right?
Yep. I'm just looking at the questions to see if we can start taking a few questions, because we have 15 minutes left. But all right, well, let's start with Kat Love, who said, where to start? I have zero libido. I'm just 52. I'm 52 and just starting to go through menopause. Like, how do women begin to sort of make sense of this if they're seeing this, having an awakening, and want to focus on themselves a little bit?
Yep. So libido is complex. Libido is marketed to us as spontaneous. And if you don't have spontaneous libido, there's something wrong with you, which is wrong. Many people, especially in long-term relationships, have what we call responsive libido. So basically, I'm not thinking about sex. Like, I run a company, I'm busy, my kids need to go to soccer practice, but you put me in a sexual context, you start touching me right, you start doing all the things that I like, and I'm like, oh yeah, I like this. And when I'm done, I liked it. And during it, I liked it. And after I'm done, I'm like, remind me that I liked that, because I always forget, because I don't have a spontaneous libido. Right. So whenever a person comes to me and they're like, I don't have libido, I always start with education to be like, are you having fun at the party? If they're having fun at the party, then I'm like, great. Do you just need to be remembered to go to the party more often? Because spontaneous libido is not a necessary element for a happy sex life. They wrote an entire book on this. It's called Magnificent Sex. Not one person with magnificent sex in their life says it's because I have a spontaneous libido. Right. So it's really education to be like, what do you think you're missing? If you're having fun at the party, just go to the party, if you're happy with that. Some people are like, I'm not having fun at the party. Okay, well, that's not a libido problem either, is it? Because we never want to do something that isn't enjoyable. So I always like to kind of break down this, I don't have libido, and be like, could it be because it's spontaneous or responsive? Could it be because you're not having fun at the party? Then we just got to work on the party. That's not a libido problem, right? And then once we understand all of that, and we also have to say, like, how's your relationship? Is it on the rocks? Do you have trouble communicating? Are you guys actually in therapy, right? Because we don't want to have sex with somebody we're in conflict with. So there can be, again, biopsychosocial, right? All that said and done, now we talk about hormones. So we can either talk about hormones like estrogen and testosterone. It's interesting. The data is mixed on estrogen and spontaneous libido. I think that's good news, because some people can't have estrogen, but there's a lot of people who are like, I got back on the estrogen, my libido came back. So I think estrogen, especially in the responsive desire, estrogen plays an absolute role. And I don't want to downplay that. I think a lot of sex med people downplay the role of systemic estrogen, and it's a thing for libido.
Yeah.
Then we have
Yeah.
testosterone. All bodies have testosterone. All bodies have testosterone.
Let's say it
Testosterone starts
again. All bodies have.
all bodies have testosterone.
Also women. Yeah.
Also women.
And men have
Testosterone.
estrogen. Also an important thing to note.
Yeah. So testosterone can be quite useful, but I can not take a woman who doesn't know anything about libido, might have a psychosocial component, put her on testosterone and expect it to work, right?
Yeah.
It's only going to work when it's a hormone problem. Then we also have dopamine. We can play with dopamine in our brain. Remember, we seek out enjoyable things. What if we increase your dopamine? And that's where the prescription medications for low libido or hypoactive sexual desire disorder come in. They work kind of like antidepressants, but by increasing dopamine instead of serotonin. And then you'll get more, in the studies, you're going to get more people saying, yeah, I wanted sex more. I liked sex more with these drugs compared to placebo. So that is you can't answer the what do you do about low libido in one sentence. It's too complicated, but that's what makes it so cool.
And there's also a difference between libido and arousal, right?
Yep.
So,
totally. I can want to have sex. I can want to go to the party. That's our libido part. But when I get to the party, I just can't get turned on, right? So that's the difference between libido and arousal. And being like lube, vibrators, external massage, erotica, sildenafil cream, all of the stuff to work on arousal, which is different than desire for sex.
Got it. It's also interesting. You made this point recently too, that the testosterone right now is only FDA or indicated. It's not even FDA approved, I guess, but the only indication for testosterone in women, like by the medical societies, is for increased libido or arousal, but for sex with a partner is generally.
It's crazy. Yeah. It's absolutely crazy when you think about it. We have very decent data on testosterone and depression, especially in men. We have very decent data on testosterone and cardiovascular protection in men. Certainly muscle mass, lean body mass, protection of bones, as you and I always talk about. Yeah. Good data on testosterone in men. We need a lot more. But what happened was we gendered this and we said testosterone was the male hormone. There's really not a lot of data on testosterone, but I'm hungry for every paper that comes out on it. Yeah, me too. It's time. All right, here's another question. I have lichen sclerosis and for a few years have had muted orgasms and sometimes cannot have any at all. I finally had a doctor that advised me that I should be on a steroid chronically. Currently using steroids twice a week, estrogen cream, I assume vaginal, but still not great orgasms. Do you think this is why? Suggestions on help. Also started estrogen progesterone this month. Help, please. We'll get you help. So that condition is called lichen sclerosis. It's an autoimmune skin condition. It's actually quite common, a lot more common than we think it is. Clobetasol is the high potency steroid that's usually indicated as first-line therapy for lichen sclerosis. I'm a urologist. I examine pelvises for a living. I want an exam. What's her clitoris look like? Is her clitoris atrophic? Do I need to add a little bit of testosterone to try to get some more blood flow in there? Does she have clitoral phimosis, which is where the skin over the clitoris hood comes down and kind of gets scarred or attached? You can have a procedure to do lysis of clitoral adhesions. If it's severe, might need a small surgery for that. So certainly exam would be the next step for that. By somebody who's trained in doing an exam. Yeah. Not by your husband. Yeah. Not by her cardiologist. Yeah. But you can either go to a specific vulvar clinic. There's vulvar clinics. There's lichen sclerosis experts, a pelvic floor physician, whether that's a urogyne or gynecologist, should be pretty good at doing a pelvic exam. A sex med provider should be able to help you out. Yeah. If you don't know where your sex med providers are, go to ishwish.com or org. I forget. Type in your zip code, find somebody nearby. I think it's ISSWH
WSH, but we can put also the link
Yeah.
in the,
Ishwish.org probably.
yeah. Here's a question about which I think I can answer from my own experience, but someone is mainly interested in the idea that vaginal estrogen can be effective in decreasing trips to the bathroom at night. Very common problem.
True.
Is 5 times often? Yes, too
Yes.
often. She thinks it is too. It's like I can't get a good sleep because I'm up every hour as if I was feeding a newborn every 2 hours. Okay,
Oh,
good. Yeah,
ugh.
that's horrible. I've had that too.
People don't realize how sleep deprived they are until it gets better, and then they're like, whoa.
And all the carry-on effects that loss of sleep has.
Yeah.
Also for sex. If you're tired, who
If
wants
you are
it?
tired, do not expect to have a libido. Your body is prioritizing, and your body having sex is not at the top of the list. We've got data on this on shift workers. We have data on this on like medical residents. We have data on this on midwives. There's multiple papers on like the role of sleep deprivation and shift work on affecting all arenas of sexual health. It's not just libido. It is the ability to get aroused. It's the ability to have an orgasm. Like sleep wreaks havoc on sex lives.
Yeah.
But getting back to this person, so 1 time or less a night is normal under the age of 65. 65 and up, 2 times a night or less is considered normal. The reason is our kidneys concentrate urine and they get less good at that as we age. So we can never, I always, as a urologist, I can never tell people I can get you to sleep through the night. Plus, there's other things that affect our sleep. Are you a light sleeper? Do you have sleep apnea? Are there, do you have diabetes? Do we have heart issues? So getting up at night to pee is complex. Topic for another podcast. But
That's
certainly overactive bladder, urgency, frequency starts picking up perimenopause, menopause. Local vaginal estrogen is equivalent to the overactive bladder medications, and is, I would argue, natural, because it's just restoring the hormones to the pelvis compared to like an oxybutynin and Detrol, an overactive bladder medication those medications don't actually work that great for getting up at night.
But it's also, it drives me crazy when people talk about estrogen or hormones generally as like a medication, because it's really not a medication. It's not invented by a pharmaceutical company. Right. We've derived obviously from things to match the exact molecules that our bodies produce naturally. Mm-hmm. So that it's almost more like a supplement or a natural, just get a little extra so that your cells don't freak out, because we have estrogen receptors in every single one of our cells, essentially, in our whole bodies, which is why menopause wreaks so much havoc everywhere in your brain, and your body, if you don't have estrogen.
Yeah. So for that person, I'd say get on the vaginal estrogen. It's easy. Mind your fluids at night. It's amazing how many people like get up to pee and drink a big glass of water every time they do that. So I'm always like, sleep and pee hygiene.
Right. Or drink tea. Don't like have a cup of tea before you go to sleep.
Yeah. Even wine, even alcohol is a diuretic.
Yeah. Yeah. No, I have that problem for sure. Do you have any recommendations for women? I know you see this a lot. So women who are managing perimenopause symptoms while also navigating ED with their male partners.
Yes, this good news is you're both in it together. Great. What a mutual bonding experience. Welcome to this phase of life for both of you. Communication. This is only a problem if you make it a problem. Otherwise you say, this is how my body's showing me age. This is how your body's showing you age. What are we going to do about it? Are we both going to make doctor's appointments? Are we both going to say, you know what, for us, our bodies like it better when we have sex in the morning or we have sex in midday, saving it till the very end of the day when the kids are in bed, we're exhausted and things just don't work as well. How do we need to adjust that? So that can be useful. And really refocusing, what do we want? This is more sex ed. What do we want to get out of sex? Why do we do sex? Right? Do we do sex just to put a penis in a vagina? Or do we do sex for other things like connection, to feel love, to know that you're my bonded person, to know that it feels good, right? And really stepping back, this is what I love adult sex ed for, is like, I give you the info, now you get to go why do you have sex? Why do you want to put something in your vagina? Why do you want to put something of yours in somebody else's vagina? Like, what are, the sex therapists and all that stuff, they'll be like, what are your feelings that you want to generate, that sex generates for you? Pleasure, safety, love, connection, de-stressing, right? It's going to be different for adventure, novelty. Those core feelings that you want from sex are going to be different for everybody. Super interesting if you ask your partner what their core feelings are with sex, right? You can learn so much for each other. And so what I'm saying to this person is to be like, figure out what you want, what sex gives you, and to say, okay, well, how can we adjust that if we want still sex to give that to us? Or how can we feel connected, close, bonded, loved, and not always need the penis to go in the vagina to generate that feeling?
Yeah. No, it's a great point. And one question I'm gonna answer very quickly. Can you use vaginal estrogen and oral estrogen at the same time? Yes.
Yes.
They're very different. So oral estrogen is systemic. It goes through your bloodstream and sort of takes care of like all of the symptoms, also including bone health and bone restoration prevention of bone loss. But the topical estrogen, the topical estrogen for your vagina, and also now we have it for our face at Alloy as well, is just topical. It does not go into your bloodstream. So, and that is FDA approved. We know that there's tons of science around the fact that at that dose, it does not enter your bloodstream. So it's just a little extra. And even if it did enter your bloodstream at such a low dose, it really doesn't raise the levels at all. Is there an actual physical data-driven reason to not start MHT by age or after age 60, I think? I realize that it's best started beginning with 10 years of menopause and okay to stay on indefinitely forever unless you experience problems or have personal medical risk. This woman could not get a doctor to prescribe at the time, but she's about to turn 61, 11 years into menopause, and she would like to start now. She has no heart cancer, et cetera, history that would raise risk, but she's been having trouble getting a clear answer. You actually did a great Instagram post about this just today.
Yep. And I would say check out my podcast. Like the episode Boomer Should Be Pissed is pretty good. Right. Yeah. And then I think the myths about menopause. So there's nothing magical about 10 years in one day. Right. Like how incredibly arbitrary is 10 years in one day. And okay, well, let's describe how arbitrary is 11 years then. Right. Why is it not 9.5 years? So there's nothing magical about that deadline. But where that came from is the Women's Health Initiative. The longer you go, whether or not you feel like you have any issues, your body has changed from 10 years with no hormones, 10 years in one day, whatever. And what they found is when they took older people and started them on hormones, older being, up to 75, 80, right? They had a higher risk of cardiovascular disease and stroke and dementia. Because they are, and this is where the timing hypothesis comes from. The timing hypothesis means put the hormones on the younger, healthier body parts, because putting the hormones on the older, changed body parts has more side effects. So what I would say is in this day and time, you need to see an expert who understands that 10 years is not a hard, fast cutoff. There are some 52-year-olds that are so unhealthy and have so many risks, they shouldn't be, like, there's nothing magical of like, it's totally safe until 10 years, right? So you really need somebody to understand where that came from, what the science is, who you are, what your goals are, all of that. But it's not an arbitrary line, but it exists because of the Women's Health Initiative.
Yeah. And I think, this really goes back, and we can end here, but this goes back to the idea that women shouldn't be told that they can or cannot have something. It should be, a conversation with yourself about what you want for your life and, how you feel, and also a conversation with your doctor to understand, what are the benefits for you? What would the benefit, I think, what do the benefits outweigh any risks? If there are risks for you individually, this is an individual sort of time of life that no woman has. There are very similar symptoms, but nobody has the exact same cocktail of symptoms as other people. And so you really need to kind of think about who you are and what your goals are for your life.
My tip for her would be so you're going to go to your physician and you're going to say, I would like to try a low dose for 3 months, and then I will come back and I will check in with you. That is a very good approach, because you're not saying, I'm going to take your stuff and I'm going to run and not let you know how I do. And I'm just going to be foolish with this of like, no, let's start low. Let's give it 3 months. Let me report back. That tends to be a very good approach when asking a healthcare provider to kind of be on board with something that you want to try.
Yeah. And this is one of the driving forces behind Alloy as well, is to be able to really create this connection between patient and doctor, woman and doctor, to be able to ask those questions whenever she wants. So we do have unlimited messaging back and forth with the doctor so that you can, make sure that you dial in to fix your own symptoms and feel as well as possible. And a lot of this, again, is driven by my own experience. I know that you don't necessarily, what you start with isn't necessarily where you end up. As you said earlier today, I think in a post, like, we're not Toyotas, everybody we don't stay the same. And even Toyotas start to sort of break down or change over time. So you might need to ebb and flow with your treatment plan. And we try to be as flexible with that as possible so that women can really get what they need and feel better and live their best lives. So thank you so much for joining us. I think we have more questions that we will try to answer in our write-up, and also we will do this again for sure, because there's so much more to talk about.
Oh, thanks for having me. I love these chats.
Me too. Talk to you soon.
Take care.
Bye, everybody.
Bye.